Ladies and gentlemen, my name is Annalise Garrison, and I have the website caringforyou.net. As many of you know, I tutor for the NCLEX. And so today we're going to talk about opioids and the NCLEX. The reason I'm going to teach you about drugs, okay, is because students, good nursing students, don't do drugs, or maybe you don't know anything about the world of drugs and drug addiction and drug dealers and drug addicts and all that. But truth be told, it is going to be on the NCLEX. So this is a topic we do need to know about. And many of us, whether we want to admit it or not, have a loved one that is struggling with drugs, that it maybe has died of drugs. And so the next few videos that I have, rest assured this will be on the NCLEX. And I'm going to teach you about drugs if you have not been exposed to that world in a non-judgmental manner, right? We all go to church. We don't even talk about it in church. It's a taboo subject in church. But the fact of the matter is, it's going to be on the NCLEX. So let's start this presentation, and I'm going to teach you, number one, about opioids and the NCLEX. And I'm going to talk a little differently in this one because I'm going to teach you about the NCLEX, yes, but I'm also going to talk to my larger audience or maybe my smaller audience. I want to reach a wider audience on what the person can do at home if they have a loved one that has overdosed on opioids. So yes, it's going to be geared toward nursing students for the NCLEX, but there's also going to be practical advice and maybe even some stories about home, right, in our neighborhoods, the people around us, and how we can help the people around us or not help the people around us. All right? So let's get started. Okay, so we see here from the first slide, let's look at the common drugs that may be on the NCLEX, or a common drug that I have seen in my own community that people abuse. Not only have I seen it in my own community, immediately around me, but I've also had the privilege of visiting the local jail and working with the jail nurse there. She was an LPN. She was really, really nice. And I followed her around for 3 days. So this is the list of common drugs that are probably going to be on the NCLEX. Maybe not now, but the next time the NCLEX changes. The NCLEX changes every 4 years, every 3 years, because it keeps up with its surroundings. It keeps up with the trends in America, right? And I can really see that one of the trends is this war on drugs that we're facing. So these are the common drugs that I saw abused in my own community and also in the jail, and that is Oxycontin, Demerol, Percocets, Vicodin, methadone, morphine, fentanyl. What people don't realize is these heroin addicts, heroin is very, very, very cheap, right? So they buy the heroin. Many people are dying of heroin overdoses because it's cut with fentanyl. Now, you nursing students know, what do we use fentanyl for? We use fentanyl as the painkiller mixed in with the anesthesia, right? So if fentanyl is being used as the painkiller mixed in with the anesthesia in a controlled environment for surgery, right? So every time we have a patient go to surgery, what are we actually doing? We are actually doing a controlled death, right? We actually put that person to sleep for 1 hour, 2 hours, right? In essence, it's a controlled death. And then we, in essence, bring them back to life after surgery, right? So this is what I want you nursing students to realize. The reason there are so many deaths with heroin overdose is because the fentanyl that is found in the heroin is not controlled. It's not measured out. It's not an exact science like it is when we do surgery, right? You know, who knows who's cutting that heroin and mixing it with fentanyl. The problem with fentanyl is it's legal in China. So that's why it's flooding the United States in its raw form. So it gets cut into the heroin. And you know, people that are doing heroin, and you know who you are, you're just playing Russian roulette. It's eventually going to catch up with you. But if we use fentanyl as a controlled death during surgery, of course you're going to die out there on the streets. It's just a matter of time. So we have fentanyl dilaudid. That is a good painkiller. Really works well, but and it's making its way out on the street. And of course, cocaine. This is not a complete list, but look at this list. Write it down. I didn't go over, every sign and symptom of each med, because these are all opioids. Opioids all do the same thing, nursing students. So what is the sign of an overdose? Whether you're at home or whether you're a nursing student, the sign of an overdose is no response to stimuli, right? Labored breathing, hard to arouse, snoring and gurgling, cyanotic lips or nails, floppy arms or legs. Some people may even lose consciousness and need CPR, right? So, how do we respond? Well, there's three main meds that we use to respond to the an opioid overdose, and that is Narcan. Now, a big thing in my community, for example, is to give out Narcan kits to everybody who, they have to go to a class, they have to be specially trained. I don't know how special you can be trained for Narcan administration in a couple hours. But we do have Narcan kits. So that's for the community. You've gone to your community classes. They taught you how to use the Narcan. That's how you use it. Right now I'm talking to my nursing students that need to know this for the NCLEX. It also might be interesting to you. Nursing students, the Narcan comes in injection. It comes in IV for those of us who use it in the hospital. It comes in subcutaneous, and it also comes in nasal spray. For those of you at home, you're going to have the IM injection, and you're going to have the nasal spray. I don't know. I'm not really familiar what's in the Narcan kit. I only know what I know for the NCLEX and for the hospitals and, for that. So nursing students, Narcan comes in three concentrations: 0.02 milligrams, 0.4 milligrams, and 1 milligram, okay, per milliliter. Again, I'm not sure what's in the Narcan kit. But what I do know is if you're using the Narcan kit, you may have to use more than one needle. You may have to use more than one spray. All right? Nursing students, 0.4 to 2 milligrams is to be used. All right? Repeat Q 2 to 3 minutes. Nursing students, as needed. Everybody, that's what PRN stands for, as needed. This is what the home users won't know. This is why I hope the Narcan kit doesn't have too many injectables in it, okay? But nursing students, not to exceed 10 milligrams, all right? So let me repeat that, nursing students, for your NCLEX. The strength we want to use comes in 3 different strengths. What are they? Good. So we take the 0.4 to 2 milligrams IV, IM, sub Q, and we repeat that Q 2 to 3 minutes, PRN when needed. Important not to exceed 10 milligrams. All right, very good. Now let's go to the next slide. Now this slide is for the home, people at home that may not have a Narcan kit. And this is really, really true, guys. If you don't have a Narcan kit, see, the person that overdosed on opioids is not non-responsive to stimuli. So you want them to get responsive to stimuli quickly. So this is really true. Go to your freezer, get some ice, and put it in the person's private parts, okay? Because this will just, like, snap them out of it. Like, what is that, Seriously. There was a Narcan lady that I talked to. Actually, I heard it on a podcast. If you guys want to listen to a good podcast, Google Dopey Nation. All right, Dopey Nation is a podcast about addiction and just stories. The guy's name is David, and he just sits around and has people on his show that they just talk about their drug use, right? Well, he had somebody on the show who was an expert in Narcan. The heroine of heroin, she called herself. And she said that she saved somebody's life by putting ice in their crotch, right? I guess that would stimulate the person real quick. But she said it does work. So if you don't have Narcan and you guys are sitting around getting high and smoking your heroin and your friend passes out, go get some ice on it out of the freezer and throw some ice on his testicles or her private parts, right? It really will work. The other thing I know that I've done before is I've taken my knuckles and rubbed them real hard on somebody's sternum. That hurts, okay? The thing is, you want to solicit a pain response or some kind of response to like jerk the person back into consciousness. So, if you don't have a Narcan kit, you can at least throw some ice on your friend's testicles or rub your friend's sternum. All right? What we're trying to do here, ladies and gentlemen, is we're trying to bring the person back to consciousness by stimulating cold, which is the ice, or pain, which is rubbing your knuckles really hard on the person's sternum. I told you this was going to be a little different. I told you I was going to talk to the home community as well as my nursing students. So this slide just does just that. Okay, I hope you guys find it helpful and interesting. All right, let's go to the next slide. Okay, so this is not, I followed the nurse around for 3 days in the jail. I did not see her administer any of these drugs. The only thing she basically did was hydration for them. And a lot of the main drug that I saw, a lot of heroin usage, right? And a lot of them say that their drug of choice is heroin and alcohol. So because of the alcohol, they were able to get hydration, they called it, but it was Gatorade. And I think that was because... that's really all they could do for in the jail for a heroin overdose is give them hydration. But this is what a true, somebody who uses heroin. Now, listen, if they are not a true heroin user, or if they are not a true opioid user, they will die if we give them Suboxone. So make sure that you do a good assessment and that they are a true heroin, hardcore opioid user, and not just someone who popped a pill one time and passed out, or did heroin one time and passed out. But anyway, let's start with the Suboxone here. So when the person gets out of the jail, obviously we're not going to do anything for you in jail. Whatever brought you here, we don't care. All right? For my larger or smaller audience that may or may not be listening. So once we start with an initial dose of 2 milligrams, 0.5 or 4 milligrams, or 1 milligram of Suboxone. So again, it comes in 3 doses. We have to let the doctor decide, which one he wants us to use. The 2 milligram, the 0.5 or 4 milligram, and then the 1 milligram of Suboxone. And we may titrate that upwards to 2 milligrams or 4 milligrams. All right, it's up to the doctor. So the low doses, 0.5, the higher dose 4. You understand, students? At approximately 2-hour intervals under supervision, and we might even titrate it up to 8 milligrams based on the control of the acute withdrawal symptoms. All right. Now, let me not be so harsh. If you're in jail, the nurse will supervise you. You will go to the ER should you need to go to the ER. So do not be afraid. We do love you to the extent that our license allows us to love you. We're there to watch you. You're going to go to the ER should you have any problems. So if you're having acute withdrawal symptoms, people in the jail or people at home will go directly to the ER after you get your Narcan, and then you'll get discharged and then started on the Suboxone, I hope. On day 2, nursing students, a single dose of up to 16 milligrams per 4 milligrams of Suboxone sublingual is recommended. But, again, leave this up to the professional doctor, the Suboxone doctor. Just know this for the NCLEX. This is all you got to do. Just know it for the NCLEX. And then on day 3, it's recommended that they use Suboxone sublingual, but most people use the pill. So you really got to follow the doctor's order. Just be aware that this is the recommended dosage for the NCLEX. So on day 3, we're going to do 2 milligrams, 0.5 to 4 milligrams, or 1 milligram to a level that holds the patient in treatment and suppresses opioid withdrawal symptoms. Okay? Now, so for the NCLEX, just know this, nursing students, for the NCLEX, here I have the sublingual film, but it also is for the pill too. And you at home, you're going to go directly to the ER should you have any complications. But for those of you who are in withdrawal in the jail, from what I witnessed, we're just going to give you hydration and let you ride it out. Hopefully you'll get ROR'd or bailed out, or you will have a court hearing within 48 hours. Okay, very good. Let's go to the next slide. Okay, Vivitrol is another medication we use. The person has to be off opioids for 7 to 10 days. We also use it for alcohol. So for a person that is experiencing alcohol abuse or alcohol addiction, we want to use 30 milligrams orally once a day. If we're using the extended release injectable, then we give them 380 milligram shot every 4 weeks. Once a day. Once a month. And of course, you want to alternate those spots. Don't put it in the same spot. So make sure you make a note of when the person was where that shot was given, because they're going to be coming back to the doctor every month. Okay. Um, Opioid. The treatment starts when they're off the opioids for 7 to 10 days. Your initial dose is 25 milligrams the first time. Your maintenance dose, if no withdrawal signs occur, 50 milligram orally once a day may be started. Alternate dose schedules is 50 milligrams orally on weekdays, 100 milligrams orally on Saturday, or 100 milligrams orally every other day, or 150 milligrams every third day. Let me repeat that. Now, don't forget, you're going to be under the supervision of a doctor, nurses, students, but you need to know this for the NCLEX. Your maintenance dose or your initial one-time dose is 50 milligrams. All right? So, you want to give 50 milligrams on weekdays, or 100 milligrams and 100 milligrams on Saturdays, or 100 milligrams orally every other day, or 150 milligrams every third day. Again, just, stop this recording and back it up a little bit and continue to listen to that. The alternate doses and the every third day dose. And the injectable is the same. 380 milligrams every 4 weeks, or once a month. Okay? So, that is the Suboxone, that is the Vivitrol. And then we want to treat the symptoms as they occur. And so let's go to the next slide. So as you can see from this slide here, there's symptoms that will occur within 24 hours. And that's your general malaise, your muscle aches, your restlessness, your anxiety. Naturally, nursing students, we're not going to give these individuals Ativan or Xanax for their anxiety, right? They just got to ride it out, you see? Lacrimation, or eyes tearing up, runny nose, and excessive sweating. So, for the first 24 hours, just comfort measures. That's really all we can do. Comfort measures. And then your later symptoms. This is probably the first 24 hours. This is why you get Gatorade in the jail, because of your muscle aches, right? You're probably dehydrated and sick, right? So what your body is 75% water, 75 to 80% water. So we give you Gatorade, otherwise known as hydration, to just, hydrate you again. You probably haven't been eating and all that. So that's why we give you Gatorade. If you want to, nursing students and those of you at home that are viewing this, if you want to see the later symptoms, more intense, begin after the first day. I actually saw this in the jail. And I didn't see diarrhea. If there was any diarrhea, nobody reported it. Probably because everyone else would laugh. But anyway, diarrhea, abdominal cramping. There was one young lady that kept complaining about her abdomen hurting. Goosebumps on the skin. Nursing students, nausea and vomiting. What can we do for that? Antiemetics. So we can do that. Dilated pupils, blurred vision, rapid heart rate, and high blood pressure. We can take care, take care of the symptoms as they occur. All right, so that's really all I have to say about this opioid presentation. Again, I think it will be on the NCLEX sometime soon, since it is such a big issue in our government at the moment. I dream of a time when we will
how so?